The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, minimally invasive facial rejuvenation. With us, we have an expert on the topic, board-certified plastic surgeon, Dr. Hurwitz, and we've invited him on the show today to talk about his limited facelift for very natural results for the younger patient and even the older patient. Dr. Hurwitz, welcome to the program.
Nice to be here, Randy.
Now, you're well known for your book, The Total Body Lift. You're known for body lifting all over the world, I should mention, and you're a professor, a clinical professor of plastic surgery at
University of Pittsburgh. Yes.
All right. And your center. So for people that don't know about your center, the Hurwitz Center, tell us, who's the typical patient and what are the procedures you do?
We see a wide gamut of patients. All of them are interested in a cosmetic improvement. They want to look better. Maybe they want to restore what they had before. Maybe they want to look a little better than they ever have. But the commonality is patients want a facelift, maybe their nose done, neck lift, breast enhancement and such. So we see a wide variety of cosmetic patients at the Hurwitz Center.
How have facelifts changed over the years? Last 20 years, you've been doing this 30 years. How is it that you're able to get better results now, more natural results now than you did 20 years ago?
I think it's safe to say, Randy, that our results are better than they were 20 years ago. They're actually safer, they're more natural, the incisions are smaller, and I better understand how to apply a given technique to a patient's anatomy and their desires. Sometimes desire simply is, I don't want to be recovering for 2 or 3 months. I want to get back to the workplace. And so you have to make adjustments, and we have better techniques and new technology to do that.
And what's everybody after? I mean, do they want to look different? They want to look younger? They want to look rested? They want to look pretty?
Well, there is a commonality to it, and a number of the things you've touched on. But every individual has their certain issues, like I look so tired around my eyes, or are we going to get rid of grandma's neck finally? I see it coming, and I don't want to look that way. So it obviously is highly individualized. Few people, and if they do, it's probably a mistake, want to look like somebody else or a movie star.
All right.
I get a few of those requests, and we have to talk about that. We probably do more talking than surgery in those instances. It is a problem because we can't change people fundamentally. We just bring out their best features and add a little bit more, maybe a chin implant, a cheek implant, or add some fat to the face. So there are subtleties we can do, but basically the job of facial rejuvenation is to restore youthful beauty to the face.
Now you're known as the guy that gives the natural look, natural looking facelift. Because I feel like I told you this in our green room over there that I feel like I could spot a good facelift, 20 yards away, 10 yards away. And you say, not my patients.
Well, if you saw the before and after, you might think they have a facelift, but it'd be hard to tell because the scars are well hidden and the skin is not pulled excessively tight. In fact, I'm not really relying on the skin lift. I'm relying on a deep tissue readjustments, repositioning, sculpturing, lifting, and then the face skin gets readjusted.
So it's more of a repositioning tissues to where they used to be?
Very much so. Very much so. With aging, we have a number of things going on. Sure, the skin can start getting wrinkled from the sun, particularly out here in Southern California where we're talking, but their volume itself, those wonderful cheeks of babies, well, they just get smaller and smaller and drift down to your jowls. And we have to, we have to learn how to deal with that. Even the bite and the jaw structure changes with aging, and some compensation has to be made for that, but only if the plastic surgeon understands what's going on.
Now, facelifting, and I'm calling it facelifting, we're talking about minimally invasive or limited facelift is what you call it, but it's become very popular, national advertising. And I want to know your thoughts on some of these. We've a lot of people, if you watch TV, you've seen the ads for these low downtime facelifts. Or what are your thoughts?
Oh, the lunchtime facelift and the quick lift, it's out there. And in fact, about 10 years ago when this came on the scene, I really had to take a close look at it, what that was and how was I going to deal with that. I found that many of these operations really, while they could make some nice adjustments in the neckline, the jawline, they were short-lived. They were inadequately performed. They were too quick, frankly. So I've come up using other techniques that I've learned from other surgeons and my own adaptations, what I think to be a good response to those quick lifts. Smaller scars, quicker convalescence, safer operations, and still a very effective and natural look.
So it's nothing new. I mean, what I see on those ads, I mean, that lift is nothing new. I mean, you guys have always been doing those kind of things?
Well, a limited facelift has been out there, and these lifts incorporate some new suture technology to help them do what they do, but I'm not impressed that they're as natural as we like or as long-lasting as we would like.
Okay, so they're not as long-lasting. Now with this lift, the max lift that we're talking about, the limited facelift, what is the max lift? What separates it?
The max lift came out of Belgium from a group of plastic surgeons, and we've a lot of plastic surgeons in the United States have adapted this maybe 7 or 8 years ago, and I'm one of them. But I've changed it dramatically so that it is more effective and more natural looking. So the max lift is a predominantly vertical pull on the face, not this backward sweep that we find a bit objectionable.
Is that what you guys used to do? I mean, it was more back instead of up?
That's right.
Is
the
that
cheeks
right?
were pulled back. That's why you get this wind-swept look. And
So that still goes on today?
Oh, yes. Oh, yes.
Really?
And that has little place to do. You know, some patients need some of that, but mostly we lose because gravity is pulling us straight down.
So going up.
And let's go up. And the facelifts did little to the cheek area. I think a facelift that does not involve the cheeks, unless the woman's unusually full in that area, is an inadequate facelift. So a limited facelift is a full facelift. It's just limited in the amount of incisions and the areas we open up.
Okay, and this max lift stands for something, acronym?
Yes, MACS, Minimal Access Cranial Suspension. So the minimal access refers to an incision that just barely gets in the temple, goes inside the ear and around the earlobe. No more do we need in many patients, just routinely scars down the back of their neck. It's just not necessary in many patients.
How many years can you take off? I mean, let's say a 50-year-old, I mean, what do you hear? I know maybe you're not, I mean, could you make a 50-year-old look 40? I mean, what do your patients say?
Well, you know, some 50-year-olds look like they're pushing 70, and some, it's hard to say. They just look younger, and I think it's common to say we knock off a decade or so, and we like it to keep it that way between 5 and 10 years more. It makes no sense to do this surgery in my mind, and 2 or 3 years later, it's all but gone.
So the limited facelift we're talking about is for the younger patient, specifically?
There are a number of indications, but I would say for sure that the younger patient, the 45 to 55-year-old woman who's just beginning to see some real changes in their jowls, their neck, and cheeks, they're the best candidates. We don't want people that have skin on top of skin hanging down the sides of their faces.
So 45, they're doing this?
Oh, yes, very much so. You know, there are all kinds of temporizing methods, and there are radio frequency applications and lasers to help the skin of the face. But for those who wish to take a surgical route, this is much more effective and certainly a quicker way to go.
Okay, let's take a look at some of these before and afters. Now this is, if they're just tuning in, we're talking about these minimally invasive facial rejuvenation. We're talking about the max lift, and this is a limited facelift, you call it.
Yes, it's limited because the scars are limited and the suspension is cranial. That's the CS, cranial suspension. Means we put stitches underneath the skin that hold the deeper facial tissues to the deeper tissues around the skull.
Okay, okay.
So I have some people, some of my patients have kindly allowed me to use their photographs for this show. Okay. And the first one, she really came to me because her eyes are too tired. Mm-hmm. What can I do about the hollowness of her eyes, the dark circles? So this woman approaching 50 not only was concerned about her tired eyes, but she did admit the jowls were beginning to really upset her, and she wondered where her neck went. The distance between her chin and her neck was just getting lost. And what could I do about that?
So what do they say? I mean, when they go to you on this consult, do they say, what do you think? I mean, do they do a little bit of self-diagnosing, like, do I need fat to my face or volume? Or, I mean, what does it sound like, these consults?
You know, everyone is an entity into themselves. And many patients have gotten rather self-educated, particularly through the internet, through programs like this, as to what the problem is and what they need to. So I listen to them all, and sometimes some extra fat or some filler is a good idea. More often than not, what they need is a vertical suspension.
So with her in particular, when you look at that face, what do you see in your mind?
I see a patient who needs an operation.
Okay.
I see a patient who needs an operation with very few incisions, minimal scars, and a relatively short operation. It's limited to the extent that we don't have to do an extensive work in the neck. The neck is pulled up through the face through suspension sutures, and so these long swelling and bruising that's so customary with a facelift can be avoided almost in its entirety. Yeah, I wanted to look in the after, keeping in mind we just had incisions in her temple.
Very good. This is nice.
Well, I appreciate that. She's got a look about her that is one of beauty, radiating beauty. And why? She has a cheek that is full, and she has a jawline that is crisp. She has not a deep neckline, but a much deeper one than she had before, and no more hanging skin. And certainly, no one would say her eyes look tired anymore.
She could look like the much younger sister. The after looks like the younger sister. When that full front look, she just looks absolutely rested. And interestingly, that you have darker shadowing on the before, and the after is brighter.
Yeah.
So that's actually good in this case because it's showing off how the result's good.
It looks that way, and interesting enough, is dramatically different as you can see in these photographs. Many of her friends really just thought she had been away for a vacation or lost some weight and didn't know it. And it's hard to believe because she knew how different she was. And you can see, even in these photographs, that inner glow in her face, knowing she's beautiful.
She's prettier, by the way, in the after.
I think so.
I mean, more than just looking younger, she looks prettier. I mean, more attractive woman.
Yeah, very feminine. Her face, which beginning to get a bit boxy with her jowls, is more oval and feminine. The cheeks are higher. So no wonder she's smiling.
In the after on the profile, by the way, before and after on the profile, it looks like that could be the daughter of the woman above.
Oh, I'm glad you feel that way. It certainly has a crisp, full jaw. That's the essence of youth, is a strong jaw that's flat. That's the essence of youth, a strong jaw that's flat in its undersurface and proud.
So when she comes in for this after photo, what does she say?
Well,
I mean, how does her life change?
She almost doesn't have to say a thing. She's brightly dressed, the hairstyle has changed, she shows more of her face when she walks in the door. I don't have to say much to her, but indeed, she volunteers that. She's just putting on makeup is a delight now. It was something she almost hid from in the past, and going out, socializing even more than before.
And when people are just tuning in, they need to know that this isn't the typical like low downtime, minimally invasive, gimmicky facelift. This is a max lift, and it's called max because
minimal access cranial suspension. So small incision, suspended vertically upward. That's what the fundamental operation. I use new suture technology, barb sutures, to suspend it up and keep it up. You don't feel knots anymore under the skin, a smoother result. There's certain adaptations I've done just to make this operation better.
Is it true some of the national advertising, we don't have to mention their name, that those lifts, because of the technique, they're attached to other tissues that can fall and they don't last as long? Is that true?
Oh, that's absolutely true.
Okay.
More often than not, these operations do not last very long at all.
Is this in the last 30 years? And you've been doing this max lift now for how long?
I've done it for 8 years now. And
you love it?
Oh, absolutely, because I really can go in the operating room confident I can deliver. I'm able to suspend the tissues more effectively, and no one's complaining about overpull, of having prolonged convalescence. I can't promise a product, and sometimes further work needs to be done, but I love it because the results are great and are very reliable.
Do women all want natural? I mean, nobody wants to look done. I've been told that husbands talk their wives out of going to a plastic surgeon because of their fear of looking done. Do you hear that?
I hear that a lot, particularly in the younger patient, but frankly, the older patient, when it really has a lot of loose skin, they tell me if I'm not done, then forget it. Yeah, you've got to make a change. And I don't mind if somebody sees that this big neck is gone. So, yeah, there are, the trend, of course, is...
But they don't want to be tight and pulled
No.
or smeared back.
Having said that, that's true. They don't want these deep grooves and lines and these Joker faces.
I see that, though. I mean, I see that, and I'm thinking, is that the healing process? Maybe they were smokers during the healing, or was it in the hands of the surgeon? Was it technique? What are your thoughts?
More often than not, it's in the technique.
Because we live in California. I mean, Newport Beach is 40 minutes from this studio, and you see a lot of unusual-looking people.
They weren't born that way.
Okay.
They're the creation of some plastic surgery that was overdone. We're not here to stamp out every last wrinkle or loose skin.
Okay.
We're here to reshape faces. And using the Max Lift as a standard of where I build upon and individualize, we can get a more natural sculptured face in most instances. I'm not here to get the last little tightness of the skin, or else you're going to get that look, Randy. So let me show you this next patient.
Okay.
It really brings the point home. She does want to look natural, and frankly, she looks angry, she looks distressed, and she's so upset about that heavy look on her face. You can see that in her jowls, how round they are. You can see her neck is just full of fat, frankly, and the cheeks have descended. Her corner of her mouth is down. And the cheeks have this ridging inside, giving a rough look, an angry look. Afterwards, a year later...
So when you see this, by the way, this is another one of these Max Lifts.
This is another
limited facelift.
This is a limited facelift because I don't have to go into the lower neck and the back of the neck. I can focus my efforts where she's heavy in the jawline, in the submental, or the neck area here. And if I can do that, I'm golden. I can do the Max Lift with these limited incisions and suspend everything.
But so repositioning tissues to where they used to be. Is that right? Am I saying it right?
No question. Okay. Reposition the cheek where it was, but frankly, removing by very sophisticated liposuction just amount of fat so that we get a smooth feminine contour. You could easily overdo it in getting ridges and irregularities of the skin. So it has to
That after looks good, by the way.
I appreciate that. She likes her jawline. She likes the nice angle of the neck.
She looks like she lost 30 pounds in the profile shot.
Most of her friends say that where have you been? You've lost all this weight and you look so good and rested.
I mean, even their friends can't tell, really?
You know, many of them miss it. You know, we are much more aware of how we look than others seem to give credit or pay attention to. Sure, our closest friends said, you didn't tell me about that facelift, but they get on very well if you do it naturally, just accommodate into their new lives.
So she's got to be thrilled.
Frankly, she was. She was really thrilled. This is just what she had in mind. You see no tight pull lines. You see no ears pulled down onto on her neck. She looks very natural.
How much art, how much science in what you're doing?
Well, the art has to do not only with the aesthetics, but dealing with the individuals. What do they want? If I didn't get this extra fat out of her neck, then it was a waste of time. And if I did it in a way to leave wrinkled skin and depressions, then I'm causing a new problem. So yeah, art and science, knowing your patient and knowing what they want, is very important.
And who's a candidate now, the older patient? Or you were mentioning at the break, it's their second lift.
Yes, when a woman starts to get back some of that loose skin and wants another facelift, they really don't have much extra skin once you release everything. The Max Lift is perfect for that because we're resculpturing and suspending the face and taking out very little skin.
Is it mostly the lower face you're addressing in a Max Lift?
Well, it may be, but many of these women never had their cheeks properly elevated. So the cheeks may come up too, the brow elevated. It depends what was done before. But what we don't want to do is pull them so tight that they look like they've had too much surgery.
So this is ideal for people that have already had a facelift. They're starting to get sag, going into the Max Lift.
There's no question. The Max Lift has a special role, and it's less complications, quicker recovery. They do very well. But having said all we've said to this hour, we should remember that this limited facelift is not for everyone. If you have a neck that is really loose and weather-beaten and dragging and looks like a turkey gobbler, you got to go to the good old-fashioned facelift. So we always have that available. And I have an example to show you.
Okay, let's take a look. Let's take a look.
Yeah, this woman for sure saw her mother and did not like what she saw. And the crepiness of her neck looked like a Venetian blinds down her neck.
Good, don't hold back here.
Yeah, she said, you got to get rid of that. If you have not succeeded, if you've not smoothed out my neck. And my
So
brow.
she didn't like her neck?
Not at all.
Okay.
Not at all. I said, while we're at it, let's get those cheeks up where they belong. And she says, they do bother me too. My eyes look so hollow. Can you fix my eyes? I says, it's not the eyes. We need those cheeks up there, and your eyes will just get better, along with raising the brow up. So indeed, that's what we did, and we can see the result of a smooth neck that's remarkably different, that no limited facelift, no quick facelift can possibly do. Having said that, the whole cheek was raised up with the idea of limited access. And
so you're
up.
moving the muscles,
the
fat, and the skin?
That's
no?
right, independently. So the skin gets, what takes time is I have to raise the skin off the face, work on the deeper structures, resuspend them to the cranium, and pull them back and trim off the extra skin and make sure that the workmanship and the tailoring at the end is so that you don't see I've ever been there.
Is the perception that all plastic surgeons, because you guys are board certified or the board certified ones, are all doing facelifts the same way? And how far, and that's not true, right?
That's not true at all. That's not true at all. Every face.
But the perception is that you guys pretty much are doing, approaching the full facelift the same way.
I think that's true.
Okay.
And that the facelift is perceived by the public as just one kind of operation. Do I want one or do I not want to buy one? But it's not that case at all. The neck, whether you deal with the underlying muscles, how much you pull, what suture material you use, where do you put the incisions in the hairline, deep into the scalp, are all highly individualized based on what you see. So every operation is a different combination of techniques. Yeah, well, Randy, if you look at the after picture, I think you'll see a very pleasing face. I don't think you're going to see the telltale signs of a facelift.
No, if that woman was walking down the street, no, you wouldn't think about that she's had anything done. And the before and after, I would say, 15 years or so.
Easily.
Off her appearance.
And she'll keep that look for quite some time, and it's not going to drop suddenly. It'll slowly evolve over.
That's a good point. So it ages just like regular aging.
That's right.
So if you had two twins at 50, one gets a facelift, one doesn't. 10 years out at 60 and at 70, will the one that had the work done look noticeably younger? Have there been any studies on this? Oh,
there have been twin studies, and yes, properly done surgery like we're talking about today will hold up, probably not change much for 5 to 7 years, and then slowly start getting the changes with exposure to sun, and loss of weight in the face. It'll change, and we'll be back.
Are you that much better, by the way? 50, 100, whatever facelifts later. Do you get that much better? Is there that much of a learning curve here?
Well, there is a learning curve, and I hope that continues for me for the rest of my career, that I incorporate other people's technology and techniques and learn from my own operations. There's probably a very few operations I do that I look at the pictures 6 months later, maybe I could just do a little better and work a little better.
Now, when I look back at this original photo, and I always think that I've looked at some photos over the years that I could diagnose. And when I look at this photo, I would have thought, okay, just put some filler under her eyes, maybe a little lipo of the neck, and that potentially, depending on who she goes to, maybe a smaller medical spa or somebody that's just doing fillers, she may have had the wrong procedure.
There's no doubt about it. There are very limited approaches to go, and some women never want surgery, and that's what they're going to get. But too often, they're really kind of unnatural.
But if this is what surgery means, this is what people would pick.
I'm glad you feel that way.
Because it's their thought of, I guess, being pulled and tight. It doesn't have to be that way.
It doesn't have to be that way. That's the bottom line. We can use, through very limited incisions, sculpturing, suspension techniques, redraping of the skin, and I pride myself. They can look very natural, and most of them are pleasantly surprised. They're mostly worried that that's not going to happen. It's going to be overdone.
Really? Now the spouses or partners, do they come in on the consult sometimes?
Oh, they come in often. They're usually there to tell them not to do it.
Is that right?
Oh, yeah. They're here to protect them from the surgeon.
That's good.
As much as I love the transformation of the women, to see their loved ones so happy about the changes they see,
And so the men are talking the women out of doing it all the time.
Usually.
Really?
Usually. They are
Because they don't want, maybe they don't want them to look done. What can you tell men, by the way, that are watching this? Allow your wife to be pretty if she wants to be pretty? I mean, what's your message?
Well, go with them. Men don't appreciate the incredible societal and personal pressures of looking their best. They must spend hours over the week in the mirror making themselves looking as good as possible. Do we do that as men?
That's a good point.
No. Society,
Good point.
women's self-image so much revolves around their beauty, particularly if they've lost a lot of their beauty due to aging. The remarkable transformation and sense of well-being that these facelift patients have is so gratifying to me and so appreciated by the men after the fact. They just don't have the pressures in society to look like that. They got to make money and they got to do well, but they don't have to look as wonderful as they can. Women, they need it. And that's the way it is. I didn't make the rules. I just live by them.
So in this economy, in your economy, it's a safe investment to invest in yourself, in your appearance.
It certainly can be looked upon that way as an investment. These women feel better socially, and for many, they can maintain their status in the workforce at the level they want.
I mean, 70 is very young today. And with hormones or great nutrition and everything else, now they can look as good as they feel.
Yeah, the way the government's going and holding back Social Security, it better be young, because we're going to get less longer. But all kidding aside, people are in better health than ever and are health conscious, and looking young goes along with that, both in their social environment and in the workforce.
So if they want to see you, they have to make an appointment right away, right? I mean, aren't you booked out like?
Thank God I'm busy, and we always have an opportunity to see people.
And you're one of the busiest guys in America.
It's hard for me to gauge that, but we're doing very well, I'm happy to say.
Okay, good. I want to thank you for coming on the show. Great stuff. And all of these photos are on your website.
Yes, they are.
Okay, good. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you just caught a couple of minutes of it, you could go to our website at wellnesshour.com, put in Dr. Hurwitz. If you can't spell Dr. Hurwitz's name, it's at the bottom of the screen. Or you could just put in the Max Lift. He'll also be under that name too. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez, host of the Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.